Okay, so we're going to get started, and I'm hoping that you will find this presentation entertaining as well as educational. So we're going to start with a new IP. I want you to meet Susie Must Be Crazy. And some of you may have already met Susie last June at the APIC conference. Have any of you met Susie? So we've got a couple of you. So it may not be as funny to you today, but I did add a little bit of new comedy. So let me introduce you to Susie. It's an incredible, as it may seem, at Happy Day Hospital finally hires an infection preventionist after 10 long months of vacancy. Susie Must Be Crazy is a brand new infection prevention. Don't let this fool you, though. She brings 10 years of hospital oncology experience. We are excited to have Mrs. Must Be Crazy and welcome her as our sole IP to this 400-bed hospital. How many can relate? Her first task as our new IP will be to get this hospital caught up on the CMS reporting requirements for MRSA Bacteremia and C.Diff LabID event reporting. She will receive top-notch IP training via webcast from this year's APIC conference. Due to her popularity, she's not here today, so she's on the webcast. Hi, Susie. So, of course, her follow-up training will come directly from the CDC NHSN Help Desk with our 4 IPs, and also our training website, as we will soon realize the site. So let's all welcome Miss Susie Must Be Crazy. Woohoo! So what do you think her first day on the job looks like? How many of you can relate to that? So my advice to Susie would be to get her priorities straight. And so once she gets her priorities straight, we'll get her on the right path here. So I want to begin by giving you guys an overlook of some online resources. I'm sure most of you already know how to access these resources, but it's here for you in the event that you have not been to our webpage. But we have a wealth of information for you. We have the protocols. We have on-demand trainings. We do have frequently asked questions. I will let you know that we are just finished up version 6 of our frequently asked questions, and hopefully that's going to go live this week or next week, so you'll be able to access that directly on the website. And then, of course, you can find all of the data collection forms and table of instructions and so forth. So Susie's first question is, why is surveillance for MRSA Bacteremia and C. difficile important? Well, we're going to tell her. So we know that among adults that C. difficile incidence has really increased over the past decade. We know that the C. difficile infections contribute to approximately 14,000 deaths each year, with 90% of those being elderly. Another recent report has come out that discussed children ages 1 to 3 also being high risk in the community settings. So we know that there are likely many reasons, right, that could cause this increase in incidence, but antibiotic use and healthcare exposure are 2 of the greatest forms of risk. And so this tells us that it really is a good indication that our prevention efforts in the hospital really need to be focused on reducing hospital transmission as well as reducing unnecessary antimicrobial usage. And then moving on to MRSA, despite a slight decrease in the percentage of Staph aureus that's resistant to oxacillin, statistics do indicate that MRSA continues to dominate among our pathogens responsible for healthcare-associated infections. So it still is a significant contributor to increased morbidity and mortality in our healthcare facilities. Some other things that I want to mention that are not on the slide is that these 2 metrics have recently received a lot of attention, as you all know. We have the state and the federal mandates, and recently the Health and Human Services has added LabID reporting for C. difficile and MRSA Bacteremia to the action plan for 2020. So if you haven't had a chance to look at that, take a look at those metrics. Really interesting. So I want to learn more about reporting LabID events using the MDRO and CDI module. Hopefully you all do too. So let's do an overview. So the MDRO and CDI module is one of 5 modules within the Patient Safety Component Manual. And once you get into that particular module, there are 2 options for reporting. You have your infection surveillance, and then you also have your LabID event reporting. And once you select one or both of these options, you'll then have the ability to select additional options if you want to look at prevention process measures in your facility or outcome measures. So Susie wants to know, which reporting option do I choose? And that really depends. It depends on your program objectives. So if you're participating in CMS inpatient quality reporting program versus if you're simply looking at assessing the effectiveness of your interventions in your facility, or if you're interested in organism-specific surveillance using the HAI criteria, and so on. So these are just a few of the objectives that you may be interested in meeting in your facility. So my facility does participate in CMS IQR program. How do I get us in compliance with the reporting requirements for MRSA Bacteremia and C. difficile LabID events? Well, I'd first like to say, Susie, that you're about a year late. Aside from that, so for today, our goals are to understand requirements for MRSA Bacteremia and C. difficile LabID event reporting to CMS via NHSN as your reporting tool. We're going to understand MRSA Bacteremia and C. difficile LabID definitions and protocols. Describe how to correctly enter MRSA Bacteremia and C. difficile LabID data into NHSN. And then I'm going to also provide you with some tips for assuring compliance with CMS requirements for the IQR program. If you are participating in CMS Inpatient Quality Reporting Program, acute care hospitals must report MRSA Bacteremia and C. difficile LabID events at the facility-wide inpatient level. And you'll hear me refer to that as FAC-wide in. And to be more specific, these are just some bullet points of the CMS requirements for MRSA Bacteremia LabID event. So the organism, of course, is methicillin-resistant Staphylococcus aureus, MRSA. The specimen source that is required is blood isolates only. Data collection occurs through the CDC NHSN through the MDRO CDI module LabID event portion. The required locations are all inpatient locations. Again, FAC-wide in. And then the required data is to report all non-duplicate MRSA Bacteremia LabID events, and that includes your community onset as well as your healthcare MRSA Bacteremia onsets. And we'll talk more about that as we progress. And then specific to C. difficile LabID events, the organism is Clostridium difficile or C.Diff. You'll also hear it referred to as CDI. The specimen source is loose stools only. Data collection again occurs through the CDC NHSN MDRO CDI module, the LabID event. The required locations are a little bit different, you'll notice. For C. difficile, it's all inpatient locations except those patient locations that predominantly house babies. So that's going to include like your NICUs, your specialty care nurseries, your well baby units, and also the babies that may be housed with the moms on the recovery and postpartum units, the LDRPs. And the required data for you to report is all non-duplicate community onset and healthcare facility onset C. difficile LabID events. Do the CMS requirements apply to non-acute care facilities? Nice of you to ask. Well, like I said before, Susie is a little bit late because the reporting requirements for acute care facilities began January 2013, and they continue to date. And then for our facility or our participating long-term care hospitals, and you'll also hear of these referred to as long-term acute care hospitals within NHSN, they will be required to report facility-wide inpatient MRSA Bacteremia and C.Diff LabID events beginning January 2015. Do we have any long-term care hospitals in here? Okay, so you guys are ahead of the game. Good. Our hospital has an inpatient rehabilitation facility, or an IRF, on the second floor. Should fact-wide in reporting include LabID events in this rehabilitation unit? What do you guys think? In most cases, yes. IRFs physically located within your acute care facility and that are treated as part of that acute care facility, you will treat those as locations within the facility. So what I mean by that is if you share staff with that rehab unit, if you share policies and procedures with that rehab unit, then you will treat them as simply a location for LabID event reporting. An exception would be if the IRF is freestanding, or if you do not share policies and procedures or staff. If they're completely independent, then you can exclude them. This is the question that everyone has. What information will CDC share with CMS? So we will share all in-plan, fact-wide in, healthcare facility onset, so the HOs, for MRSA Bacteremia and C.Diff LabID events. Patient-level data is not shared. Only aggregate data from the participating acute care facilities is shared. The CDC will provide a standardized infection ratio, as Maggie discussed earlier, for each of the hospitals, fact-wide in, HO, MRSA, Bacteremia, and C.Diff. I do want to emphasize that although the metric that is reported to CMS will be the healthcare onset, the community onset events are also important, and that's why you must enter those. They are used in admission prevalence of a hospital, and they do play an important role in risk adjustment. And you're going to learn a lot more about this tomorrow morning when you attend the advanced analysis presentation. Some online resources that are available specific to CMS are here. We have just a tremendous amount of guidance for you on how to report, how to set up your facilities, what to report, how to enter the data, using the SIRs and so forth. So if you haven't visited this site, I do encourage you to take a look. Some important dates. I just put this on here for your information, but this is how the data, your deadlines for submitting data, so that we can get your data submitted to CMS. So each quarter's data must be entered into NHSN no later than 4.5 months after the end of the quarter. So I just put some examples on here for you. And then again, I also want to emphasize that your data should be submitted monthly to NHSN. I am not familiar with LabID event reporting. Can you share more details? LabID event reporting allows laboratory testing data to be used without clinical evaluation of the patient. Very important. And it allows for a much less labor-intensive method to track C. difficile and MDROs such as MRSA. I do want to emphasize that these provide a proxy infection measure of healthcare acquisition, exposure burden, and an infection burden, based primarily on laboratory data and limited admission data. And you're going to hear me talk a little bit more about this as we progress through the slides. This methodology seems much different than the HAI methodology I'm used to. And right, I'm sure all of you have been saying that as well. And what you're going to learn about now is going to be different than what you learned in this morning's presentation with CLABSI. So the methodologies for LabID event reporting are much different than the HAI reporting, and they're two independent reporting methodologies. So if you're following both in your reporting plan, then you're going to report differently, and I'm going to show you a couple of examples. So believe it or not, there are some advantages to using LabID event reporting. First is it allows objective laboratory-based metrics without the extensive chart review that's required for CLABSIs, CALDIs, SSIs. So it's much quicker. It allows you to identify vulnerable patient populations, again, without the excessive chart review. It allows you to estimate the infection burden in your hospital, possibly even your community, surrounding community. It allows you to estimate your exposure burden, and also to assess the need for interventions or maybe the effectiveness of interventions that you already have in place. Because it is standardized case definitions, it also increases the comparability between clinical settings, which is really nice to have. I do want to share with you, in 2008, Shea and Hickpack did publish a position paper, and the metrics that are outlined in this paper really are the foundation for the LabID event reporting protocol. So if you haven't reviewed this or have a copy of this, I definitely encourage you to get a copy of this and review over it. But in some summation of this position paper, they do support the use of proxy laboratory-based metrics based on the timing of culture results as well that are relative to the patient's admission to the facility. And again, the reasoning behind this is because it does reduce the variability in the application of the definitions, which are important. Okay, I'm listening, says Susie. What is the difference between LabID event reporting and infection surveillance, or HAI reporting? So I have a nice little table. This table is in the protocol, so I'm sure you can't read this on your handouts or if you have the small tablets. But just really quickly, I just want to point out some differences here. The LabID event protocol is in Chapter 12, and that's what you use for LabID event reporting, versus if you're using infection surveillance. I want to speak to that for just a minute. So infection surveillance protocol, it allows facilities to utilize the NHSN HAI definitions to conduct surveillance in the facility and to report infections that are specific to certain MDROs or C.Diff that you're interested in tracking. It applies to inpatient locations only, okay? And if you are following an organism using the infection surveillance module, you must do surveillance for and report all infection types associated with that particular organism. So looking at the LabID event, so I'm just going to do some comparison here. So the protocols, we just talked about signs and symptoms for LabID event. Signs and symptoms do not matter. Remember, it's strictly laboratory and admission data. There's no clinical evaluation of that patient. That's important for you to remember. And I think that one area is what causes the most frustration for many of our users. It's a tough pill to get used to. Versus infection surveillance, or HAI, you do use a combination of laboratory data and a clinical evaluation of the patient, signs and symptoms, the medical record, and so forth. For LabID event reporting, the HAI and present on admission rules that Kathy spoke about earlier today do not apply. The transfer rule does not apply. The location of the patient at the time of specimen collection, that's the location that you would enter for that LabID event. Pretty simple, huh? Okay. And the event date is the specimen collection date. So there's really not a lot of thought process that goes into the surveillance rule for LabID. Versus infection surveillance, you do apply the transfer rule, you do apply the POA rule and specific protocols. Denominator reporting, for LabID event, you're going to report the number of patient days and admissions, and this can be reported for a specific location or the facility-wide level. Now remember, if you're only reporting for CMS, you're going to report at the facility-wide level. Versus infection surveillance, you're looking at device days and patient days separately for each individual location in the facility. And then the categorizations of infections, I'm going to go over this extensively, but LabID events are categorized based on inpatient and outpatient and admission and specimen collection dates, versus the HAI and infection surveillance uses very specific protocols for categorizations. I do want to emphasize that the LabID event categorizations do not apply to HAIs or infection surveillance if you're using that module. They only apply to LabID event reporting. Does this mean I must report LabID events and HAIs separately? What do you think? Absolutely. So again, they're two independent reporting pathways. And that means you would report twice if both are included in your in-plan monthly report. So for example, if you have a patient in the ICU with both a CLABSI and a MRSA Bacteremia LabID event, each event should be reported separately within the NHSN application. So you would report the LCBI CLABSI event using the applicable HAI criteria, and then you would report the MRSA Bacteremia LabID event using the MRSA Bacteremia LabID reporting protocol. This is just an example of the screen that you'll see for each, and I'm going to go over this in more detail as we move on. I do just want to point out one thing here because I get some questions. Is this mouse working? Here we go. So looking at the bottom screenshot, this is the screenshot of the bloodstream infection event. If you are following MRSA in your ICU, and this is what we're reporting here, 5 West ICU, if you're following MRSA in the MDRO infection surveillance plan, then you would answer yes to this question. Otherwise, it's always a no, okay? Hopefully that makes sense to you. So this MDRO infection surveillance question is specific to in-plan reporting of infection surveillance events for the organism that you're reporting. So many times, most of you do not report through infection surveillance, so it's going to be no for most of you hospitals, okay? So how do I get started with reporting my MRSA Bacteremia and C.Diff LabID events? So to help Susie out, we're going to use a checklist today. And again, this may be an overview or a review for the seasoned IPs in here, or it may not. So the first thing we're going to do is we're going to tell Susie that she needs to review the location options that are set up in her facility and map inpatient locations as necessary. So with that, you have several options for location reporting within the LabID event protocol. You can do the location specific here, and with that you can monitor LabID events in specific selected locations within your facility, or you can choose to monitor all locations in the facility, and you'll report all LabID events separately from the specific locations that you're choosing to monitor, but also you would report a separate numerator and denominator from each chosen location. This is quite intense, and I'm not sure that we have many facilities that choose this option. The next side, the overall facility-wide inpatient, fac-wide in, and or outpatient, fac-wide out, is the option that most of our facilities choose, and with this, you can monitor all inpatient locations and or all outpatient locations if you choose, and you will report LabID events separately for each location. And then for inpatient locations, you're going to only report 2 denominators for the entire facility. That's your patient days and your admissions. So there's no splitting it out between locations, okay? If your facility is choosing to monitor outpatient locations at the fac-wide out level, first of all, I'd like to say you must have a lot of resources if you're able to do this, because that is time consuming. If you're doing that, then again, you're going to report all LabID events from your affiliated outpatient locations, okay? So your ED, your surgery centers, any outpatient location that's affiliated with your hospital. And you'll report one denominator for all of those outpatient locations, and that is patient encounters. And we're going to talk a little bit more about this. But remember, for the CMS requirements, you're going to go this route, all inpatient locations, okay, under FACWIDE N. Since LabID events must be reported on the unit level, how do I set up my locations for facility-wide inpatient reporting? I know that most of you are probably completely beyond this point, so I'm going to go through this fairly quickly. So I just want to point out that the FACWIDE N is an inpatient option, and it's already set up in the application. You don't have to set this up, but what you do need to do is make sure that all of your inpatient locations are mapped in the NHSN location, and what happens is they automatically all fall under that umbrella of FACWIDE N, okay? So really quickly, to do this, you would go to your patient safety homepage here, and I just recommend first just running a list to see what locations are already mapped. If you're not sure, this will be more efficient instead of entering a location only to find out that it's already in there. So you can run the list by going to your locations here, and you want to select inpatient, the ward that you're interested in. You want to make sure that you select your status and find. And this gives you a list of all of the inpatient locations that are currently mapped in your application, and they should say active. Now, if the location that you're looking for is not here, at that time, all you need to do is click Add, and then enter the applicable information, and your location will be added. Okay? Okay, so now that we have reviewed setting up our locations, let's take a look at the monthly reporting plan. This is very, very important. So the monthly reporting plan informs the CDC which modules a facility is participating in during a given month. We refer to this as in-plan data. So if it's reported on your monthly reporting plan, then it's considered in-plan, okay? And when it's considered in-plan, that means that you must follow the NHSN CDC criteria. So the CDC, the plan also informs CDC which data can be used for aggregate analysis, and this includes data that are shared with CMS. A facility must enter a plan for every month of the year, and you can always go back and modify your plans retrospectively if you need to. Just a side note, NHSN will only submit data to CMS for those complete months in which the following are indicated in your monthly reporting plan. So you have to indicate FACWIDE N, MRSA LabID. The requirement for CMS is blood specimen only, but we do have several facilities that follow MRSA all specimens, and that's okay. So you would select the one that you're following, and then you would also want to make sure that your FACWIDE N CDI LabID event is in your monthly reporting plan. And just, so this is a screenshot of your monthly reporting plan. So you can see here to add, you would click add. You're going to select your month and your year. And then you're going to scroll down to the multi-drug resistant organism module. And from there, you're going to make your selections. So you can see here you have FACWIDE N, MRSA, LabID event blood specimens only, FACWIDE N, C.Diff, and it would be all specimens, although we all know it's stool. And then be sure to hit save. Okay, and once you save, you should get this message that lets you know that your plan has been saved successfully. So as a side note, I do want to mention that if your facility does report LabID events for MRSAs in all specimen sources, we will pull out the blood specimens, and that will be used for the CMS reporting. We will not report all specimens to CMS, okay? We are participating in a C. difficile prevention collaborative in one of our inpatient units. I want to target C. difficile events in that unit in addition to the facility or fact-wide end monitoring. How do I add this unit to my monthly reporting plan? Do we all know how to do that? Okay. So this can pretty easily be done by going to your reporting plan, and you want to find the plan that you're interested in modifying. Okay, click Find, and then you will edit the plan. And then you'll see here on her current plan, she does have the fact-wide end for MRSA as well as C.Diff. All you would need to do is add an additional row. And then when you do that, you would add the unit that you're interested in monitoring and the organism, and then make your selection here. Just remember that if you are going to monitor an additional location and you want to monitor that separately from the fact-wide end, then you'll also be entering denominator data for that specific location in addition to the fact-wide end, okay? So that unit will be included in both your fact-wide end and then additionally as a separate unit. And that it just allows you to look at your data for that unit specifically. Okay, moving right along. So we've set up our report, and now we're ready to report. So next we're going to show Susie how to enter her MRSA Bacteremia and C. difficile LabID events into NHSN by location. Some points to keep in mind when using the MDRO CDI protocol to identify MRSA Bacteremia and C. difficile LabID events. You want to make sure that you're reporting all identified MRSA Bacteremia and C. difficile LabID events from all inpatient locations. This means that specific locations where the patient was assigned at the time of that specimen collection must be indicated as your location. And I'm going to talk about some provisions for the emergency department and affiliated outpatient locations. Okay. So for fact-wide end LabID event reporting, for specimens collected in your emergency department or other affiliated outpatient locations, if that specimen collection date matches the physical inpatient admission date, so that they're the same calendar date, okay, then you can report a LabID event from that outpatient location, and you would assign it to the admitting inpatient location, okay? But remember, the calendar days must match. Now, to make it a little more complicated, for fact-wide in and outpatient, so if you are monitoring fact-wide in addition to fact-wide out or specific outpatient locations such as your emergency department, if your date of specimen collection equals the physical inpatient admission calendar date, then you have to do two things. You report it as a LabID event for that admitting location, so that covers the fact-wide in portion, but you also must report that LabID event for the outpatient location since you are monitoring that particular outpatient location. So you would report twice, okay? This is a common question. What if the specimen was collected from the emergency department on 4/1 at 11:55 p.m. and the patient was later admitted to an inpatient location on 4/2 at 12:03 a.m.? Can I enter this as an inpatient LabID event for fact-wide in? What do you guys think? Okay. No. The specimen collection day and the admission day must be the same calendar day. The application has business rules in place, and it will not allow any type of exception. And also, just as a side note, the application does not recognize hours, like the 24 hours. It only recognizes those calendar days. And so that's the reason for that business rule. Okay. So now let's delve in and get a little bit deeper, specifically into our MRSA Bacteremia LabID event reporting. Okay, this is a little bit of repetition, but it can occur in any inpatient or outpatient location of your choosing. Okay, we've already talked about the note here, so I'm going to move on. The definition of a MRSA positive blood isolate: any blood specimen obtained for clinical decision-making purposes. So this excludes any screening cultures, which I don't think there are screening cultures using blood. So that's really if you're looking at all specimens, would that apply? But if you are monitoring all MRSA specimens, you should be excluding any specimens that are obtained for surveillance purposes, such as the nasal swabs and so forth. Definition of MRSA Bacteremia LabID event. So a MRSA positive blood specimen for a patient in a location with no prior MRSA positive blood specimen result collected within 14 days for the patient and that location. Okay? If you're monitoring blood specimens only, this does cross over the calendar months. Okay, you'll hear this or you'll see this referred to as the non-duplicate LabID events within the protocol. So a duplicate MRSA Bacteremia LabID event, one which you would not enter into the application, would be any MRSA blood isolate from the same patient and same location following a previous positive MRSA blood laboratory result within 14 days. And you notice the key word that I'm saying here, although I didn't highlight it, but the key word is laboratory result, okay? So that 14-day rule is applicable to the most recent result, not the most recent LabID event that you entered, okay? That sometimes is an area of confusion for the users. In case you're yawning right now, I've got a picture. This picture is also in the protocol, and I know that as adult learners, many of us are very visual, and this just simplifies it, in my opinion. So here it is, simplified for you. So everything I just said in one nice picture. Okay, what do I do once I identify a MRSA Bacteremia LabID event? Well, you're going to add that event into the application. And to do that, you're going to open your application and go under Event and click Add. And then you're going to enter your basic demographic information for the patient, so anything that has a red asterisk. And then once you do that, you're going to go down to your specific event information, and you're going to enter your event type. So it would be a LabID event. That's what you're going to select. The date of that specimen collection, the specific organism that we're looking for, in this case is MRSA. Was this an outpatient? The specimen body site source. If you're doing blood, it's always going to be card, and then your specimen source will populate, and you're going to select blood specimen. And then the other things, the date admitted to the facility, the location of the patient, the date admitted to that location. And we get a lot of questions about this next data field of documented prior evidence of previous infection, and I'm going to talk about this, but I will for now say that this is auto-populated and it's based on the previous month, okay? So if you're entering a second, third, fourth, fifth LabID event for that patient and it's in the same month, likely this is still going to say no, okay? So it's looking at the previous month, and I'm going to tell you why in just a minute. And then, has a patient been discharged from your facility in the past 3 months? On this page, I do want to point out that the location, and that's going to be the location where that patient was located at the time the specimen was collected. Remember, there's no thought process in this. Another very common question, what if the electronic medical record shows that the patient was admitted on 4/1, but the patient remained in my emergency department until 4/2? What admission date do I use? What do you guys think? hear a mix. 4-2. So your admission date, when you know this, your admission date should reflect the date that patient was physically admitted to an inpatient location. Obviously, especially for those of you who work in huge facilities, you may not know that information. And if you don't know the information, you have to go by what's on the medical record, okay? But if you do know that information, then you would enter the date the patient was physically admitted, okay? And in that case, it may knock out the LabID event. You may not even be able to report it if that's the case. Okay, another common question. If a patient has a history of MRSA, can I change the documented prior evidence of infection or colonization with this specific organism to indicate a yes? What do you think? No. So again, that field is auto-populated by the NHSN application, is based on the prior month of LabID events entered for that organism and that patient in your facility. Next question. Well, what is the purpose of this data field? Susie asked. Great question, Susie. So the information is used to calculate the MDRO infection colonization incidence rates when your facility is reporting all specimens, not just blood specimens, okay? So what this means is that facilities are not being penalized when it comes to all specimen infection colonization incident rates. So that will change to yes if the patient has a history of that particular organism in your hospital. I will also just mention to you that the data field is not used in C. difficile analysis. We get most of our questions around the C. difficile and this previous infection. So the categorizations of your LabID events are not based on this particular data field. This is really something that we use internally for analysis and to confuse our users. I'm just kidding. Since I must enter all MRSA Bacteremia LabID events, how does the NHSN application know which ones are healthcare associated? Great question. So you all are going to hear HAI and LabID event used interchangeably. But I do want to emphasize that LabID events are not considered HAIs necessarily, because I know that you all know that not all of your LabID events, even the healthcare facility onset, are truly HAIs, right? So I just want to emphasize that you will hear it interchangeably, and you may even hear me say it interchangeably by accident, but they are different, and I just want you to know that. So then that brings us into the categorization of our MRSA blood specimen LabID events. So all of your MRSA blood, they are categorized as either community onset or healthcare facility onset. And the NHSN application will categorize these based on the date of specimen collection and admission. Okay, so a community onset will be categorized if the LabID event specimen was collected while the patient was an inpatient in your facility for less than 3 days after admission. Okay, so if that specimen is collected on day 1, day 2, or day 3, the application is going to categorize it as community onset. Now, if that specimen is collected after day 3, so on day 4 or after, the application is automatically going to categorize that as healthcare facility onset, okay? What if the patient was admitted with a suspected BSI, but the blood culture was not collected until day 4? Will this still count as healthcare facility onset for my facility? How many of you have asked me that question? Very popular question. Don't throw anything, but the answer is yes. So remember, LabID events are categorized as HO or CO based on that admission date and specimen collection date. The business rule does not allow exceptions for signs and symptoms, including those that may be present on admission, okay? And just keep in the back of your mind that this allows for more effective standardization of reporting across facilities. Okay, so let's just do a really quick review of MRSA Bacteremia, and then we'll move on to C. difficile. So remember that MRSA blood specimens must be monitored throughout all inpatient locations within your facility if you're participating in FACRIDE-N. All MRSA blood LabID events must be entered regardless if they're community onset or healthcare facility onset. A blood specimen will qualify as a LabID event if there has not been a previous positive blood culture for that patient, that organism, and that location within the previous 14 days. And then any specimen that is collected in your emergency department or affiliated outpatient location may be entered only if the specimen collection date matches the admission date, okay? I do want to, one thing that I have not mentioned that I do want to just let you know is that the affiliated outpatient location, it must be affiliated outpatient location with your facility. This does not include sister hospitals or other facilities inpatient facilities that may be associated with your hospital, okay? Okay, let's switch gears a little bit. This one is going to be easy because it's very, very similar. So C. difficile LabID event reporting. It can occur, again, in any inpatient or outpatient location, except, this is a little bit different, you will exclude locations that are known to predominantly house babies. So this includes your NICU, specialty care nurseries, babies in labor and delivery and recovery, postpartum locations, well baby nurseries, or well baby clinics. Now, this does not mean that you have to go to your pediatric floors and locate all of those little babies. It doesn't mean that. You're only focusing on locations predominantly housing those babies, okay? And the reason behind this, which I'm sure most of you already know, is that we know that infants have a high prevalence of asymptomatic colonization. So you don't want to have your rates skyrocket because you're testing infants that are possibly just colonized and not actually infected. So that's the reason behind that. Again, we've already talked about this, but the calendar days must be the same if you're collecting from an outpatient location. I got a little bit ahead of myself because her next question is, do I exclude babies housed in pediatrics or other non-baby locations? So what's the answer? No. So again, the intent is to maximize standardization across our facilities, but at the same time, reduce that extra burden on the IPs of having to manually look for those babies on those units. Definition of a CDI positive laboratory result is a positive laboratory test result for C. difficile, toxin A, and or toxin B. It does include your molecular testing, your PCR, and or toxin assays. You could also use a toxin-producing C. difficile organism detected by culture or other laboratory means performed on a loose stool specimen. And I do want to emphasize that you should only be testing and reporting on unformed stools that conform to the shape of the container. All of these different laboratory tests for C. difficile confuse me. Can you help me to understand the differences between these two tests? Well, I agree. They are a little bit confusing. There are a variety of tests available for laboratory confirmation of C. difficile. We know that. I'm not going to spend a lot of time on the various testing methods, but I did put this table together for you in hopes that I could highlight the most common diagnostic measures for you so that you could just get an idea of what your hospital is using and if it demonstrates evidence of a toxigenic strain. What we see most commonly used would be the GDH antigen testing, here, which when done alone does not test for toxin, but we commonly see that used in a two-step method with the EIA or the NAT testing. And then, of course, you have your cell cytotoxicity in your culture down here as well. So this is here for your reference. And again, this is not all-inclusive. I'm sure there's probably others out there. So our definition of a C. difficile LabID event is a toxin-positive C. difficile stool specimen for a patient in a location with no prior C. difficile specimen reported within 14 days for that patient and location. So it's pretty much the same as the MRSA Bacteremia, aside from the organism difference. And again, you'll see this referred to in our protocol as a non-duplicate LabID event. So again, a duplicate would be a toxin-positive result that was collected for the same patient and same location within the past 14 days. And I do want to mention for all LabID event reporting, it does cross admissions. So if the patient is discharged from your facility but then comes back and is readmitted into the same location with a previous LabID event, the 14-day rule still applies, okay? Again, for us visual learners, here's a pretty picture. And this is also in the protocol for you. So Susie wants to know, are you saying that I must report 2 LabID events if a patient has a toxin-positive stool collected while in 2 different locations, even if the collection occurs within the 14-day time frame? What do you think? Yes. And we ask users to do this because it allows users to have the ability to track the patients between locations so that you have the ability to look at potential transmission in your facility if you have an idea of every location that the patient spent some time. I will also really stress this to you that when analyses are done, the system is designed that it does remove duplicates, and the analysis is done at a facility-wide level. So those unit-specific LabID events that you're entering will be dropped if they're a duplicate in the overall facility-wide numbers, okay? That's important. So once I identify a C. difficile LabID event, what is the next step? Well, you're going to add it. And again, this is the same process that we talked about with MRSA Bacteremia. You're going to go to your event page and click Add. You'll enter your patient demographic information. Everything red asterisk is required. And then you will scroll down to your event information and you'll enter event type as LabID, the date your specimen was collected, specific organism will be C. difficile, and your outpatient, yes or no, specific body site, digestive system, specimen source, always be stool, date admitted to the facility, the location where the patient was when that specimen was collected, and so forth. And again, this additional data field at the bottom is the same as I just told you about the MRSA Bacteremia. It's based on the previous month, but just remember it's not used in any CDI calculations, okay? So really, you can ignore it. What if the medical record shows that the patient was admitted on 4/1, but the patient remained in the ED until 4/2? What admission date should I use? Well, we just learned this, Susie. The admission date should reflect the date the patient was physically admitted to that inpatient location, if you have that information. Okay, since I must enter all C. difficile LabID events, how does the NHSN application know which ones are healthcare associated? Once again, keep in mind that LabID events are not the same as healthcare associated. They are proxy infection measure only. Instead, the application will categorize those C. difficile LabID events as healthcare facility onset, community onset, and then you'll notice here there is an additional categorization for C. difficile, and that's community onset healthcare facility associated, or COHICFA. And just keep in mind that these categorizations are based on the date that the patient was admitted to your facility, as well as the date of specimen collection. Okay, so these are the same. I will just talk a little bit more about the community onset healthcare facility associated, the COHICFA. So that categorization is assigned to only to community onset cases, okay? So first it gets assigned as community onset, and then it will be further categorized as a COHICFA if that patient was discharged in your facility in the last 4 weeks prior to the date of the current specimen collection. So remember that question that asked, has this patient been discharged from your facility in the previous 3 months? Well, that's where this comes from, okay? And then, to take it another step further, NHSN will further categorize C. difficile LabID events based on the specimen collection date and prior specimen collection date of a previous CDI LabID event for your facility. Okay, it doesn't count if they were in another facility, so this is specific to your facility. So it will be categorized as incident or recurrent. Okay, so incident would be considered a new case, and this would be any CDI LabID event from a specimen collected greater than 8 weeks after the most recent CDI LabID event, or if that patient had not had a previous CDI LabID event documented for your facility. And the recurrent will be categorized if the LabID event, the CDI LabID event, was collected greater than 2 weeks, because remember, anything under 2 weeks would be a duplicate. So if it's greater than 2, but less than 8 weeks after the most recent CDI LabID event for that patient in your facility. Will a patient in my facility still be categorized as a COHICFA if he or she spent time in a nursing home between admissions to my facility? What do you think? Yes. So although that patient could have spent time in another facility in between the previous discharge from your facility and that new admission, that additional information is not asked or utilized because of the increased burden of searching outside your facility, and also because not all facilities have the same access to that type of information. Some of you are very fortunate. You're at a facility that provides you lots of resources, and you have great electronic medical records, but then you have other facilities that aren't granted those same resources. So they may not have the ability to gather that information. So we want to make sure that we are comparing apples to apples. And then just to point out, if you don't already know, you can use custom fields within the event page to add that information if it's something you're interested for tracking internally, but the CDC and NHSN does not gather that data at this time. And then I also just want to point out that LabID events, the COHICFA LabID events, they are simply an additional level and subset of the CO events. The COHICFA LabID event data are not shared with CMS. This was really put into place for facilities for your own purposes, if you were interested in tracking events such as this for your prevention measures or so forth. So there's no, you're not being penalized for COHICFAs. Okay, another very common question. What if the patient was admitted with diarrhea, but the stool was not tested for C. difficile until day 4? Will the event still be categorized as healthcare facility onset? What do you think? Yes. Again, it's going to be categorized regardless if it's collected more than 3 days after admission to your facility. Okay. Again, just to re-emphasize that the signs and symptoms are not applicable for LabID event reporting. So what if the patient has a history of C. difficile, but was retested in my facility greater than 3 days after admission? Will this event still be categorized as healthcare facility onset? She's really pushing it, isn't she? Yes. Okay. So ditto to what I just said, Susie. But I will say, and you'll be happy about this if you don't already know this, the incident and recurrence that I just talked about, only incident healthcare facility onset C. difficile LabID event data are shared with CMS, okay? So that's good news, a little bit of good news. And again, it applies to events in the same facility only. Okay, let's review. So C. difficile toxin-positive specimens must be monitored throughout all inpatient locations within a facility. The exception for C. difficile are the baby locations, and you can use the 80-20 rule in the NHSN protocols if you are not sure. All LabID events must be entered, regardless if they are considered community onset or healthcare facility onset. Only loose stools should be tested for C. difficile, and then a toxin-positive loose stool specimen qualifies as a LabID event if there has not been a previous positive laboratory result for the patient and that location within the previous 14 days. But wait. According to the LabID event protocol for MRSA and C. difficile, I must only report NHSN positive isolates that occur greater than 14 days per patient, per isolate, per location. Is this correct? Is she correct? Yes. Okay. So only non-duplicate LabID events should be entered into the NHSN application. Okay, so now I have some more good news for you. I think you're really going to like this. All right, so how many of you use the VAE calculator? How many of you like it? Well, guess what? We have this similar calculator coming for LabID event reporting. Woohoo! So we are just finishing up the final touches on this calculator, and I'm so excited about it, and it's going to be available in the next few weeks, hopefully sooner rather than later for you guys. It is going to be available for C. difficile and any of the MDRO LabID event reporting, so MRSA, C. difficile, or anything else that you may be monitoring on the LabID event side. It is going to help you with decision-making around that 14-day rule. It is an external calculator, meaning you can't data dump into the NHSN application. So really think of it as a data entry versus thinking, because you do have to enter the lab results in the calculator, but then you don't really have to think. So it's just kind of pick your poison. Do you want to think, or do you want to do manual entry? Now, another way that you can use this tool is if you have new IPs come on board. This is a great way. Give them the visual pictures that I showed you and have them sit down and practice in the calculator, because nothing is saved. You're not entering patient identifier data. They can access it even from home. You can give your new IPs homework and tell them to go home and practice. It's really there for you to use however you choose to use it. I will also tell you that it is a work in progress. We are going to continuously work on this to make it better and better. And, eventually, I envision someday to be able to add additional variables that will allow you to throw that data into the application to cut down. But who knows? So it is a work in progress. I think you guys are really going to like it. The next few slides that I have are really going to be most useful to you when the calculator is available. So hang on to these slides. All of these are going to be available for you after the training. But just to give you a little bit of a tease here, I'm going to show you some things. So similar to the VAE, you're going to choose your organism. So you can see all of the organisms are listed here that are in the LabID event protocol. And then you're going to select your reporting type. So again, you may be reporting all specimens, or you may be reporting blood specimens only. Depending on how your monthly reporting plan is set up, the LabID events is going to be a little bit different. So make sure that you answered that correctly. And then you can use generic locations already built into the calculator, or if you want to type in your own locations, you can also do that. And then you choose a reporting month and a reporting year. And then once you do that, you're going to enter the specimen collection date and the organism and the body site and so forth. So this just gives you an idea. I'm not going to go into specifics, but I did enter some down here and took a screenshot so that you can see what information that you're getting. So you're going to enter your information, and it's going to tell you yes or no, or it doesn't know. And it doesn't know when it's in the grade fields, and there will be more information on the calculator to explain what all that means for you. And then, again, this is just some more screenshots. And then this slide just provides you with some bullet points that I think will be helpful for you when you start using the calculator. Again, it's not going to make a lot of sense for me to go over this right now because it's not available, but know it's here when you get ready to use the tool, and this will help you hopefully get off to a smooth start. Okay, we're getting close on our checklist here. So now that we've identified and we've entered all of our MRSA and C.Diff LabID events, the next thing that we have to do to wrap up the month or the previous month, I know that I need to go back and correct something I said because I heard some uh-ohs. I said all data needs to be entered monthly, and I didn't mean like you have to, on the 31st, you have to enter everything in. I just meant that enter it in as soon as you can, and just know that the dates of the CMS reporting, and once the data is sent to CMS, you can't fix it. I mean, you can fix it in your system, but it doesn't get resent. So enter them as soon as you can. We like to say, try to enter it for the previous month by the end of the next month, as soon as you can, basically. I'm not going to. Okay. So next we're going to enter our denominator data. Okay. So to enter your denominator data, you're going to go to the summary data on the page, and you're going to click on Add, and then you will select Summary Data Type. And for LabID event reporting, it's always going to be the MDRO and CDI Prevention Process and Outcome Measures Monthly Monitoring. Click Continue. And then you're going to select your month and your year. And then you're going to notice that you have 4 different lines here to enter data. So the top under General, that is total patient days. So that's total inpatient days in your facility. And then total inpatient admissions for your facility. And then jumping down here, if you're monitoring C. difficile, which you most likely are, in a FACT-wide location, you're going to subtract your NICU and your well baby counts like we talked about. So your total patient days up here are not going to match your total patient days and admissions down here because you're subtracting those baby locations, if you have baby locations, okay? So the top is MRSA Bacteremia and the bottom is C. difficile. And then I just want to point out the encounters here. You'll notice it's not asterisk. That is if you're doing outpatient monitoring, and then you would enter your encounters. Okay. So once you do that, you're going to want to scroll down to the bottom here and make sure that under MRSA that you have a box that's checked, but it's going to be grayed out. And then the same thing for C. difficile, because what this does is it confirms to you that you do have a monthly plan set up, okay? If those are not checked, that means you need to go back and edit that monthly plan to add, okay? So you will not have to do anything with those, but just check them and make sure they're correct. And what do I put in the box labeled encounters on the denominator form? So again, that refers to the number of patient visits into an outpatient location if you're monitoring outpatient locations. And I have my own opinions about outpatient monitoring and FACT-wide out. So if you ever want to have a discussion about that, pull me aside. Okay. Checklist. We are almost done. So the last thing we have to do is resolve any alerts that we may have because we were not paying attention to the training. So the most common alert that you may see is the that will be triggered, I should say, is if you is called report no events. And that happens if you had 0 events for the month, LabID events, let's say MRSA Bacteremia. You have to remember on that form, and I'm going to show you, I should have put a screenshot, you have to go back to that summary form and check no events reported. And if you don't, it's going to trigger a reminder alert for you. And I'm going to show you a screenshot in just a minute. Also, just to point out, if you fail to fix the alert, then that data will not be submitted to CMS. So it's really important that you take care of those alerts on a timely basis before the data is transmitted over. Okay, so we talked about that. You're going to, now, let's say that you want to complete this denominator form early, so on the 29th, you go ahead and you complete it, and you mark that my hospital was so good, I had no events. But then on the 30th, you have an event. What happens is the application will automatically uncheck that for you, so you do not have to go back and remember to do that. Okay. And here's the screenshot that's a little bit late, but this is what it looks like. So the report, no events here. And again, you're only going to select that next to the box that's already checked, okay? Oh, my goodness. We have lots of time for questions, folks. Okay, so what I'm going to do now is I'm going to open it up for questions. So we have until 4:30 for questions, and then we'll have a break, and we're going to come back and do some fun case studies. Okay. I think I'm going to either be impressed with my teaching abilities or just sum it up that you guys are really tired. Oh, we have a question. The mic. Can someone turn on the mics? They're coming.
Okay, good day.
Hi.
Tamika from the Virgin Islands. I have one question, I hope it's one, for location mapping for the postpartum unit. We do coupling care. And so if it's the baby is well, they get to stay out with their mom. So it's like 50-50.
Right.
How would we class that location?
So you could do it a couple different ways. I think probably the easiest method to save you some time would be just to take the number for that unit and cut it in half for your C.Diff denominator. And that way you don't have to manually count if that's what you commonly do on that unit. Okay. So you would still map it as the LDRP, but just know because you do couple the babies, just take half of the number for C.Diff. So the whole number for MRSA or other MDROs and half for C.Diff.
Because what happens, it seems, for nursery, when we do our reporting, nursery still count their babies even though they're out, because the nursery staff still comes over to postpartum to follow up with the babies and still go back to nursery.
So they're kind of getting counted twice. Yeah. So you would definitely exclude, okay, so I see what you're saying now. So you're talking really for the MRSA side. So
and C.Diff as well.
So C.Diff, you would exclude the nursery and then take your mother-baby count and half that. Okay. Now for the MRSA part, because babies are included, baby locations are included, for MRSA, you would just have to either take the full count for the LDRP and ignore the nursery, or somehow, if you're pretty confident that the LDRP unit is the most accurate, you want to take whatever's the most accurate for that baby count.
Okay.
You
can go ahead. That answers my question.
Okay.
My question, I'm Gail Walsh from Indianapolis. My question is, we do the LabID for C.Diff We don't do the infection reporting. So when this is reported to CMS, are we going to look worse because of the rules around? I know you're saying that it's a health care onset and not an HAI. So is that how it's looked at, or?
So the analysis queens are really going to hone in on all of that stuff tomorrow. I'm certainly not the expert, but I will tell you that your HAI infection rates are not going to be compared to your LabID rates because you will have a discrepancy. Many of our facilities follow C.Diff LabID event reporting. In addition to, they follow the NHSN GI and GE criteria for C. difficile, and there is a discrepancy there because the GIGE are obviously they're looking for signs and symptoms and was it present on admission, and LabID is not. So you will see a discrepancy, but it's not comparable as far as reporting goes.
All righty,
Does that make
thank
sense?
you.
Okay.
This question actually goes back to this morning, but I think it sort of applies. I'm one of the LTAC representatives, and we outsource our labs. When we get blood cultures, our lab sent me notification right before I left that to be cost efficient, they decided that they were going to eliminate the anaerobic component, and we were only going to be testing aerobically for blood cultures. So instead of using 4 bottles, we're going to be using 2.
Okay.
I know that, I mean, I'm not comfortable with that whole situation, but, you know, I guess I'm just wondering, from what I understand, when reporting an infection, you have to have both components on both draws in order for it to be reportable, correct?
Well, no, not necessarily. If you have a pathogen that's isolated, or let me back up, an organism isolated, that can be used on either or to meet the LCBI criteria. And the same thing for LabID. If MRSA is isolated in the blood, regardless of how that MRSA was tested in the lab, then it qualifies. Kathy, am I wrong on that? Yeah. Okay, she wasn't paying attention. No, just kidding. Yeah, but no, that's correct. But what I'll do is I'll just discuss that during our break, and if it's different than what I'm telling you now, I'll give you an update. But
okay, yeah, because I mean, there could be. I mean, theoretically, it's a 1 in 100, but there could be an anaerobic microbe that's only anaerobic, and you're not going to catch that on the aerobic.
Yep.
So.
And none of the definitions at this time. I don't think any of them do, differentiate between the aerobic and anaerobic testing. And we've actually had a couple of questions that come into our NHSN box about that. And we tell them if it meets criteria for the organism, then it meets criteria.
Okay, so this is a trend then that's going on that they're starting to...
It may be now that you're mentioning, yes, because we have lately had a few questions about that. So maybe it is. Yes.
I'm Ginger Florschinger-Franks again from Idaho, and I have a question that this may not be the place to ask it, but it has to do with data validation of C.Diff.
Okay.
So I don't know if this is a place to ask it.
Well, I guess it depends if I can answer it or not. I could give it my best try.
Just say I'm right, and that'll work.
Okay, you're right.
So I'm charged with validating C.Diff. And
for the state?
For the hospitals are part of the state HAI prevention plan, so not all the hospitals. But what I'm doing is I'm just looking at strictly at the lab result. Is it positive, and is it entered into NHSN, and that's all I'm doing. Does that seem reasonable?
It does to me.
Thank you.
But I'm not a validator. I definitely think that's a conversation that we should have on the side with some experts in the room, and I'm not sure who's in here that could answer that, but definitely we'll talk about that some more.
Thanks.
I just have one more question.
Okay.
In your definition for it was MRSA, we use the oxacillin resistant. Mm-hmm. If the facility uses cefoxitin, does it pick it up as MRSA?
Ooh. So how does your laboratory report? Does it report as MRSA, or does it report the antibiograms and you have to determine?
the lab reported as MRSA based on if it's resistant to cefoxitin.
Okay, so if it's MRSA, so for MRSA LabID reporting, if it's MRSA, it's MRSA. If you look in the protocol, there each of the MDROs, including MRSA, have very specific definitions, and I can't cite them off the top of my head, but it is in the protocol. If you want to take a look at that, and it'll tell you.
Because I know we check MRSA, but when we have to fill it out for each antibiotic, like say resistance or whatever, for oxacillin, we will put not tested. So how does NHSN, I'm just wondering, how would it recognize our information?
So you're talking about for HAI reporting, right? Not for LabID.
For LabID.
So for LabID, you would just select MRSA. So for HAI,
I'm talking about HAI, correct.
Yes.
Sorry.
So for HAI, you would put your organism and then do your antibiograms. So if the lab does not report it as a methicillin-resistant Staph aureus, if they report it Staph aureus and then provide you with the specific susceptibilities, then you would enter it as the Staph aureus with those susceptibilities.
But how would NHSN interpret it if I put oxacillin was not tested?
It would interpret it based on the other
cefoxitin.
I think so. I don't want to tell you for sure because I don't know those definitions on top of my head, but I think so.
Yeah, because
yes.
Yeah, I'm putting it as I see it, but my concern is how is NHSN recognizing or recognizing the data if we're not using oxacillin?
Well, it's not going to. Remember, the HAI data will not be included in the LabID, so that's separate.
Okay.
So that's really looking at whatever HAI that you're reporting and the organisms associated with that particular HAI. So that's different than LabID event reporting.
Okay.
Okay.
Thank you. Okay.
Oh, and let me just add to that. I just got a nod that all three are considered MRSA for the NHSN definition. So yes. Okay. Any other questions?
All three what?
All three of those organisms she just listed. Oxacillin, methicillin, and cefoxitin. All three. Okay, very good.